Hello, Year 7. We're on to our next lesson, which is about birth and labour. Now, you've already looked at a PowerPoint looking at the different stages of birth, and that's if you have a normal, typical birth, how there's 3 stages with contractions, and then heavier contractions when you're pushing, and then actually the baby is born, and then the afterbirth where the placenta and umbilical cord are removed. Not all labours and births are as has been described in that PowerPoint. Many mothers will have completely different experiences. They'll read all about it, and actually their births are very different to what they would have imagined. I have 2 children, and those experiences were extremely different. So some people might have to have a caesarean section, where instead of the baby coming out of past the cervix and the vagina, it's actually removed through an incision through the abdomen, and then you cut through the stomach, not the stomach organ, but the abdomen, cut through the uterus and remove the baby that way. And many of you might have been delivered via caesarean section. And the other thing to consider is premature babies. So we're going to catch up with Chloe and Jack now and see how they're getting on. So here they are, Chloe and Jack. So Chloe, my back really aches and my stomach muscles tighten. Remember, she's having contractions every few minutes and it's painful. Jack thinks they better go to hospital. The midwife thinks that she might be in labour. Jack's a bit concerned because actually the baby is not due for another 8 weeks. If they try and stop the labour, Chloe and the baby could be harmed, but the babies might not survive if they're born too soon. The earlier babies are born, the lower their chance of survival. So this is what we call a neonatal ward, and these are little cots, but you also have incubators. We can sometimes delay labour, but not if the mother or fetus are at risk. We should be able to care for and monitor the baby until it is developed enough to go home in a neonatal ward. Okay, so the doctor says the Chloe's waters have broken. That changes everything. We're going to need to deliver the baby straight away. So the baby has been delivered and it's 8 weeks early. It's very small. They've called it baby Isaac. It's been transferred to the neonatal ward. It's going to need to be monitored and he needs machines to help him breathe. Not yet fully developed. He should have been inside for at least another 8 weeks. Okay, as you'd seen on that PowerPoint last lesson, actually fat happens at about 38 weeks when the baby starts to put fat on. So there's not much fat, it's just sort of skin and muscle. So it's very difficult for the little baby to keep warm and retain that body heat. So that's going to be an issue. The lungs are actually one of the last things to develop. So if they don't work properly, the baby won't be able to get oxygen from the air yet. So they're going to need help with that. The actual sucking mechanism that a baby will use for breastfeeding or use with a bottle doesn't develop until about week 36. So the baby cannot use a bottle or feed from the breast yet. So it's got a feeding tube that's going to go down around the back of its throat, down its esophagus into the stomach and put food straight into the stomach. The baby's vital signs, their blood, their heart rates and how much oxygen's in their blood needs to be monitored. And these are 2 little monitors that they're putting on their feet. The baby might need regular blood tests, so they'll pierce their foot and squeeze some blood out of there and send that off for testing every so often so they can see how the baby's getting on. So here we go, that we'll have a ventilator tube to help it breathe. Remember, this little baby, Isaac, should have been getting oxygen via the placenta for at least another 8 weeks. Feeding tube, as I've said, they won't be able to feed from a bottle or a breast yet. Blood oxygen sensor, the heart rate sensor, and actually an incubator with a very specific temperature, the body temperature, and that'll keep the baby warm. Because if the baby was left in an open sort of cot, the baby would lose too much body heat, and that could cause it to become very ill. Very premature babies go straight into an incubator in the intensive care unit. However, 8 weeks later, these hospitals do a wonderful job with these expert neonatal consultants and midwives and all the fancy machinery to keep the baby alive and to enable it to develop. It's more like it's just developing in an outside uterus for another 8 weeks. And then baby Isaac is finally ready to go home and start his life with his parents. And he is at just the same stage as any other baby, although he might be on the slightly small side.